I was devastated, frightened, scared. I mean, everything all rolled into one.
For years, Pam Jean faithfully had her annual mammogram. She was completely caught off guard when a lump she found in her breast turned out to be cancer.
I was very much in denial. Didn't want to believe that, I was going through this.
Pam had a lumpectomy and then mastectomy. She still faces radiation, chemotherapy, and a second mastectomy. To help guide her through all the questions, physicians, and decisions is Kim Parham, a St. Thomas Health Services nurse navigator.
To me, what a nurse navigator is seeing a patient once they've been given a diagnosis of breast cancer and helping them adapt emotionally, plus getting them through the treatment process and even after the treatment.
But I am very thankful, though, to have had Baptist Hospital to take me under their wing with Kim. I met Kim when I went in for a mammogram after the tumor was discovered. And she took my hand and took me into her little office, and we sat and we talked, and she explained to me what the program was all about. Told me a lot of the things that they do, and the support, gave me lots of resource materials that I don't know what I would have done without them. My husband and I both went over them, and we had everything that we wanted to ask, and it was answered. So, and I wouldn't have known what to ask without that, so I was very grateful for that.
The nurse navigator helps provide a continuum of care for each patient. When cancer is suspected, a patient is matched with a nurse navigator. Initially, this expedites the diagnostic process and reduces the patient's anxiety. Once a cancer diagnosis is made, the nurse navigator continues with the patient through their full course of treatment. STHS has nurse navigators helping patients diagnosed with breast, colon, and lung cancer.
They become that patient's best friend. They will work with the patient and their families to make sure that they expedite through the treatment process and through finding out that they have a cancer diagnosis or that they don't have a cancer diagnosis, making sure that pathology returns quickly, that those patients never are without a friend in the system.
That kind of careful attention and support for the patient is coupled with the latest technology at STHS, including Mammocyte technology to treat breast cancer.
Mammocyte technology is yet another tool in the way that we manage breast cancer. It's not our primary tool, it's not the main tool, but what it is a very interesting tool that allows us to irradiate a portion of the breast, the area at greatest risk for the tumor coming back, in a period of about 5 days with 10 treatments during that 5 days, and achieve control rates of the cancer in the breast equivalent to about 6 to 7 weeks of radiation therapy delivered on a daily basis.
St. Thomas Health Services also has the latest for the treatment of brain tumors, something Chuck Wilson can appreciate. When a malignant brain tumor returned last year, it was inoperable because of its location. So he was referred to the brain lab at St. Thomas Hospital, where he had radiosurgery with an ovalis-shaped beam.
It allows us to get to deep parts of the brain without causing a lot of destruction of the intervening brain, that the route you would have to go through if you were operating. So for Chuck, we were able to shrink up this regrowth of his tumor in such a way that he's able to continue working and enjoying his life. And thankfully, so far things are looking great for Chuck, and he's just a beam of light around here.
It's marvelous. Even miraculous. It's miraculous. As I say, my tumor was very deep in my brain, almost in the exact center of my brain, and it would have been totally inoperable. And so the chance that God gave me was the brain lab, and it was magnificent, magnificent. I tell everybody about it these days.
In the brain lab, they take a team approach. Physicians from a variety of medical specialties weigh in on designing treatments for each patient. It's a concept that's being used to treat other types of cancer.
We'll be launching a multidisciplinary lung clinic, and in that clinic we'll have pulmonologists, medical oncologists, thoracic surgeons, radiation oncologists, And a patient who is suspected of having lung cancer or any type of chest cancer will be able to come to our clinic and see all of those physicians in one spot. Hopefully this will be a quicker diagnosis, less anxiety for the patients. We'll be able to treat them quicker and they'll have a better prognosis.
But along with the expertise and cutting-edge technology, we never forget there's a patient who's dealing with a difficult diagnosis.
And what we provide is customer service. And that's how we can differentiate ourselves. We happen to provide health care, but we are customer service in the customer service business. We will provide that customer service. We've been doing it for years through our physicians and our medical staff. I've heard the best things from patients. I get letters every day from patients that have had wonderful treatment in our centers, everything from mammography through the hospice service. It's just been fabulous. And that's where we make the difference every day.
I'm just blessed to be here. I think I have a passion and I love working with the women and their families. And I'm glad I've been given that opportunity.